Yes, can you read this question?
Fibers of transverse abdominis arise from which part of the inguinal ligament? Transverse medial one third, lateral one third, lateral two third, lateral half, middle one third. Transverse. Arise from which part of the inguinal ligament?
See, you have got an external oblique which is coming above downwards. Then you have
Yes.
got a internal oblique and
Going down.
transversus abdominis. They are coming from below upwards. Okay. And in that also we have discussed the iliac crest and part of the inguinal ligament from where they are coming. Are you
Yes.
getting it? Okay.
Yes, sir.
So now we are talking about the transversus abdomen, which is the innermost muscle. Okay. And that is going from above downwards. Okay. This much information we have logically. Okay. So now
Yes.
let us talk about, they are asking with respect to the inguinal ligament. Okay.
Medial one third, sir.
How it will come medial one third, doctor? But anyway, we'll see. We'll see. Okay. Answers we'll see. Next question. Next question.
A midline abdominal incision below the umbilicus passes through all of the following, except pyramidalis, linea alba, extraperitoneal fat, scarpus fascia, transversalis fascia. We have midline abdominal incision below the umbilicus passes through all of the following: pyramidalis, linea alba, extra transverse. Except this abdominal incision is about linea semilunaris, kya sir?
No, abdominal incision, they are midline abdominal incision below the umbilicus will pass through all.
Of the following except pyramidalis, it will go linea alba, it will go extraperitoneal fat, transversalis fascia, E, option E.
Okay, we'll see the answers. Okay, D and A. Okay, the option D is a lateral half, because you know this transversus abdominis will come from the middle anterior two third of the anterior two third of the this iliac crest, middle part. Okay, and then comes the inguinal ligament. So it has to be the lateral half. Okay, so whether it is lateral two third, definitely middle part it won't come. Medial part also it will not come. It will only come in the lateral only, because it is the you have got a assist. So it is coming posterior to the assist, and anteriorly it will the lateral part of the inguinal ligament. So it is how much? It is a lateral half. Okay, remember lateral half. Then second is the pyramidalis. The pyramidalis is on either side. Okay, when you are strictly going in the midline, so this pyramidalis will be on right side and left side. It will not be in the middle. Okay, it is a paired muscle. You got it?
Yes,
Hello.
sir.
Yeah.
Yes, sir.
Next.
The transversalis fascia contributes to which of the following structures on the anterior abdominal wall? Contributes to which of the following structures on the anterior abdominal wall? Option A, superficial inguinal ring, deep inguinal ring, inguinal ligament, sac of indirect inguinal hernia, anterior wall of inguinal canal. So E option is not there. Deep inguinal ring. D.
Deep inguinal ring. Okay. Next question.
The transpyloric plane of the abdomen passes through the lower border of L1 vertebra, passes through the spleen, the third part of the duodenum, the tail of the pancreas, the origin of the superior mesenteric artery, the fundus of the gallbladder. Passing the transpyloric plane of the abdomen passing through the lower border of the L1 vertebra passes through the fundus of the gallbladder.
I think it is origin. Yes, fundus is also there, but origin of the superior mesenteric artery is also there.
Is also there, yes.
Yeah, yeah. So B and D they have given. Yeah, B is correct. Deep inguinal ring. Okay. Because the deep inguinal ring is in the that is the defect in the fascia transversalis.
Fascia
That we know
transverse.
well. Okay. And here what they have given D answer. The origin of the superior mesenteric artery. But I think fundus is also correct. Most probably the
Correct.
fundus is also correct. Okay. The
A
next.
32-year-old woman undergoes a phalansteal incision for cesarean section. Post-operatively, she complains of numbness over the skin just above the pubic symphysis. Just above the pubic symphysis. Which nerve is most likely injured? Iliohypogastric, ilioinguinal, ilioinguinal, sir.
Okay. Next.
During pregnancy, weakness of which muscle predisposes to diastasis recti? External oblique, internal oblique, transverse abdominis, rectus abdominis, sir.
Yeah, D rectus abdominis. So let's see about the question 5. Correct answer is ilioinguinal nerve. Ilioinguinal nerve supplies the skin over the mons pubis, labia majora, and upper medial thigh, commonly injured in financial incision. This is very frequently asked single best answer question. Okay. Iliohypogastric supplies the suprapubic skin, but more superiorly. Okay. So generally we get confused between iliohypogastric and ilioinguinal. Okay. But iliohypogastric supplies suprapubic skin, but more superiorly. Okay. And second is the rectus abdominis. Question number 6 is the rectus abdominis. That is diverification of the recti, separation of the rectus abdominis along the linea alba, common in multiparity and pregnancy. Dr. Sansi, I think someone else is there. Dr. Monica, you want to go ahead with the questions? Is there anyone in the meeting? Or Dr. Sansi, you go ahead. Hello,
A
doctor.
midline, a
Hello.
midline infraumbilical incision risks injury to which vessel? A midline infraumbilical incision risks injury to which vessel? Inferior epigastric artery, superficial epigastric artery, deep circumflex celiac artery, lumbar artery, femoral artery. Midline infraumbilical incision. Inferior epigastric, superior epigastric, deep circumflex, lumbar or femoral. Mm, inferior epigastric.
No,
No,
inferior.
B, B, B. Superficial epigastric arteries. B or
Super.
C?
Yeah. Midline infraumbilical incision. B. Superficial epigastric artery runs in the superficial fascia. Inferior epigastric artery lies laterally and deep to the rectus. Okay. Now question number 8 and 9.
The umbilicus at the level of which, but at the level of which vertebra in an adult? L3, L4, L3.
I think,
Which
okay. Yeah, go ahead. Go ahead. Mhm.
which structure passes through the inguinal canal in female? Round ligament of uterus.
Yeah. This question number 8, whether what they have given, normally the L4 should be the answer, but they have not given L4. So whether they have given L5 or sorry, L3. Okay. So it is at the level of the L3, L4, classically L3. Okay. Important for abdominal landmarks in pregnancy and laparoscopy. Okay. Question number 9 is round ligament of the uterus. Female inguinal canal contains round ligament along with the ilioinguinal nerve, and ovarian vessel run in suspensor ligament. Next question.
An indirect inguinal hernia emerges through which structure? Superficial inguinal ring, option B, sir. Deep inguinal ring.
Correct, correct, correct. So it is a deep inguinal ring. Indirect hernia will enter the deep inguinal ring lateral to the inferior epigastric vessel. Direct hernia will be medial to the inferior epigastric vessel. Okay, so what difference we saw between the direct and indirect hernia with respect to the inferior epigastric vessel, and between the femoral hernia and the inguinal hernia with respect to the pubic tubercle. Okay, that we have seen when we
Yes,
were
sir.
discussing about the. Go ahead with the next question.
Which anatomical feature differentiates a direct inguinal hernia? passes lateral to the inferior epigastric vessel, wrong. Enters deep inguinal ring, wrong. Covered by cremastic fascia, protrudes through. Option D, sir.
Correct, correct. And what were the boundaries of the Hazelbust triangle we discussed? Hazel,
Inferior epigastric artery laterally,
yeah,
rectus abdominis muscle medially, and inguinal ligament
below,
in the
down,
lower.
inferior. Okay. Lateral
Yes.
border of the rectus abdominis is medial. Okay. And laterally you have inferior epigastric. Okay. And this
Yes,
triangle
sir.
is also very important from our laparoscopy point of view. Okay.
Yes.
So correct, correct. Okay. Next.
The medial boundary of the femoral canal is formed by which structure? Femoral vein, femoral lacunar ligament.
Correct. And lateral boundary is by
Femoral vein.
correct.
Femoral
Correct,
vein. Sorry.
correct. And most laterally, what you have lateral to the femoral vein, you have femoral artery along
Genital,
with one nerve. Which nerve?
genital branch. No, femoral branch of
Femoral
genital
branch of
genital.
genital. Correct. Okay. That
Yes,
is why
sir.
if you remember those pictures, no, specifically I brought those colorful pictures for you people.
Yes, sir.
Next, so protrudes through the Hazelbust triangle. Direct hernia is medial to inferior epigastric vessels. Indirect hernia is lateral and it is congenital most of the time. Okay. So correct answer is C, lacunar ligament. Femoral canal boundaries. Anteriorly you have inguinal ligament. Medially there is a lacunar ligament. Lateral there is a femoral vein, and posteriorly there is a pectineal ligament. Okay. Now you can remember these boundaries also with one question. Okay. Go ahead with the question number 13.
Which structure is not contained with the femoral sheath? Structure is not contained with the femoral sheath. Femoral artery, femoral vein, femoral canal, femoral nerve, deep inguinal lymph node. We have femoral artery, vein, femoral canal, femoral nerve, deep, D. It is outside the femoral. Deep inguinal lymph node, option E.
Femoral,
Femoral nerve or femoral nerve.
femoral sheath contains artery,
Vein
vein,
and
and canal. Femoral nerve lies outside the sheath.
teeth.
Outside the sheath.
Yes.
Okay, next.
Which of the following statements regarding the formation of rectus sheath above the arcuate line? Above the arcuate line is most accurate. The anterior wall is formed only by the external oblique aponeurosis. The posterior wall is formed by the conjoint tendon. The internal oblique aponeurosis splits to contribute to both anterior and posterior wall. This is true. The transverse abdominis aponeurosis contributes to the anterior wall only. The posterior wall is absent above the knee. Option C. C.
Yeah. So option C. Above the arcuate line, the rectus sheath is formed anterior wall by the external oblique aponeurosis, anterior lamina of the internal oblique aponeurosis. Posterior wall is formed by the posterior lamina of the internal oblique aponeurosis and transversus abdominis aponeurosis. Okay, the internal oblique aponeurosis splits into anterior and posterior lamina above the arcuate line. Okay, that is why the C is correct. Why others are wrong? Internal oblique also, the rest all are wrong only. Okay. I think these are the last question. Go ahead.
Most of the neurovascular structures supplying the anterolateral abdominal wall run in which anatomical plane? Most of the neurovascular structures are supplying the anterior run in which between between internal oblique and transversus abdominis muscle. Option B.
Correct, correct. Next.
Within the rectus sheath, the inferior epigastric vessels predominantly lie in which anatomical plane? In the inferior epigastric vessel. Between external oblique and internal oblique, between internal oblique, between rectus abdominis and post. Option C.
Correct, correct. Okay, so here the correct option for 15 was option D, the thoracolumbar nerve, subcostal nerve, accompanying vessels supplying the anterolateral abdominal wall run in the neurovascular plane between the internal oblique and transverse abdominis muscle. This plane is classically described as a neurovascular bundle. It is a target plane for transverse abdominis plane block. Okay, tap block is given here. It allows nerves to travel laterally before entering into the rectus sheath medially. Okay, so internal oblique and transverse abdominal plane is a neurovascular plane of the abdominal wall. That is why correct answer is for question number 16. Sorry, for question number 16, the correct answer is C, between the rectus abdominis muscle and the posterior rectus sheath. Okay. The explanation: the inferior epigastric vessels enter the rectus sheath at the arcuate line. They ascend deep to the rectus abdominis muscle. They lie between the rectus muscle and the posterior rectus sheath. This plane is often referred to as neurovascular plane of the rectus sheath. Okay, that is the neurovascular plane of the rectus sheath. Okay, and this is the neurovascular plane of the anterior abdominal wall as such. Okay, so rectus sheath plane is not same as the tap plane. Okay, rectus sheath plane is different, and this uh, tap plane is different. Transverse abdominis plane is different. Okay, so that finishes the today's